Osteoporosis and nutrition. Do you want to learn how to eat for healthy, strong bones and get to know a little bit more about the alkaline diet for less inflammation? If so, you're in the right place. I am I'm a holistic medical doctor transforming women's health with root cause solutions. And today on the Wild Wisdom Show, we're going to be talking about anti-osteoporosis nutrition, the alkaline diet for less inflammation and stronger bones. So, what is interesting to note is that up until not too long ago, and actually, I would say even now, most scientists and doctors would say that the acid load of your diet doesn't impact your health, let alone your bones. But now we know from more recent research that it does actually. And so I'm going to be going through some of the information that has been proving this to be true. We're going to be covering what are the acid foods and the base foods that counteract the acid. We're going to be talking about how much protein do you need, and does protein affect the acid-base balance, and how can you incorporate it into an alkaline diet, and more. So stay tuned. So the research that has been done showing that when we eat foods that are acidic, so they increase the acid load in our body, the bones respond to the acid load by releasing minerals into the blood. So what happens is that when our blood has a certain pH range, as in the acid base balance sits at a certain value at 7.35 to 7.45. It's a very narrow range, and the body will do everything it can to keep it within this range, because if it goes too much high, so it becomes alkaline, you can get an alkalosis, which is damaging to the body. And if the pH goes too low or too acid, then you can get an acidosis, which is also very damaging to the body. And we'll talk about what that looks like. And so it used to be thought until recently that the body would buffer, kind of maintain that healthy range through action at the level of the kidneys. So getting rid of things that, cause that acid load, or at the lungs, breathing out carbon dioxide, for example, to decrease the acidity in the blood and the tissues. But now studies such as this one called the bone buffering of acid and base in humans, published in the American Journal of Renal Physiology in 2003. Now, what you have to understand is that these studies have been published by kidney specialists or nephrologists, the very group of people who thought that the acid-base balance was maintained primarily through the kidneys are now showing, some researchers within that group have been really delving into the topic that actually the bone is helping buffer. So let's say you eat a food or drink a drink that's very acid forming in the body. There are many mechanisms that will occur, some at the lungs and some at the kidneys, to decrease that acid load. But even in healthy individuals without any medical conditions, what will happen is that the bone has a lot of alkaline minerals to balance out that acid, such as calcium and magnesium, and it will pull calcium and other minerals like magnesium from the bone and pull it into the blood to balance out the effects of that acid load from the food and drink, to maintain that pH balance. And the net effect is very bad for the bone. The bone loses minerals. Whereas if we can maintain our diet more alkaline, so there is such a thing as too alkaline, that's the alkalosis, but within a good range of that 7.35 to 7.45, not too acid, not too alkaline, then the bone doesn't actually have to give up its minerals. And if the diet is slightly alkaline, more in that alkaline range, the bone actually receives minerals. The body will compensate for that slightly alkaline range by putting calcium into the bone. So wouldn't it be interesting to know that one of the major root causes for osteoporosis, which is just a huge epidemic in today's society, is actually our food and our diet, and the fact that the modern diet, mostly Western, but now that Western diet is being eaten many places around the world, is primarily acid So we are going to be talking about what are those foods and what's going to happen when we eat those foods and what can we do to mitigate it, right? So I have a few people joining me today. Shay said, perfectly said. So thank you, Shay, for joining us today. And I look forward to hearing from all of you as we go along. Put your questions and thoughts in the comments, either if you're watching this live or as a replay. So, what studies like this and other studies have shown by experts in this field is that the short-term effects of an acid diet is that the body has to get rid of calcium through the kidneys. So that's the kidney effect of an acid diet. So it'll lose calcium, which is obviously not good for bone health. And it'll increase that loss of mineral from the bones. It'll pull calcium and other minerals like magnesium from the bones to balance out that acid effect. And there is a study specifically looking at this called Diet Acids and Alkalis Influence Calcium Retention in Bone in the Journal of Osteoporosis International, published in 2001. So again, everything I'm talking about here is completely evidence-based, because some people will listen to, say, oh, the alkaline diet, the acid-based diet, the pH diet, that's just woo-woo. It is not woo-woo. Now, sometimes people interpret it incorrectly and use the information incorrectly. And what I'm going to do today is be very clear on exactly how you need to eat in order to maintain a good acid-base balance in your body for appropriate bone health and more. Now, the long-term effects of an acid diet is that when you get to a point where maybe it's been a few decades, your bones have been losing minerals consistently, trying to buffer that acid effect. And now that the bones simply don't have enough minerals to give up, right? It's trying its best. Now you've gone from strong, healthy bones to osteopenia, which is a bone disease where you're losing that bone mineral density and that mass. And you may even have progressed to osteoporosis, where that bone mineral density and mass is so significant, you can see it on the scans, on the DEXA scans, which are x-rays looking at your bone mass. It's been diagnosed maybe by your doctor, and you're at an increased risk for fractures, breakage of the bone, because that bone is so weak now because of loss of minerals. So now the body has lost the ability to compensate. So what happens is that the body gets into what the medical term is a low-grade metabolic acidosis. So the body is staying at more towards that low pH range, like that 7.35, rather than the higher, more alkaline 7.45 range. And that may seem like a very small difference, 7.35 to 7.45, but the pH is logarithmic, which basically means that a small change in the pH number is actually a massive change in our body. So you get into this low-grade metabolic acidosis, and the net effect on the body is that the body starts to release more cortisol. So you get into hypercortisol states. You start to get what's called insulin resistance, which is what is seen in chronic conditions like diabetes, cancer. Basically, most chronic diseases have some form of insulin resistance cropping up, which is very interesting, given that this acid diet may actually not just affect bone health, but also other conditions. And you get muscle loss because you get inflammation. So the net effect is that the body starts to experience this low-grade inflammation. Now, you may not see it on blood work, for example, but it's happening in the tissues. And one of the results of it happening in the tissues is that the muscle starts to lose its volume and its strength. And some people will start to notice that even though they're eating the same and exercising the same, or maybe even exercising more, they're just simply not able to get that muscle mass that they desire. And this is one of the very potential root causes. And now what we have here is that there is a research study that's called the Dietary Acid Load Mechanisms and Evidence of Its Health Repercussions, also published in a kidney journal called Nephrologia in 2019, should you want to look up this specific long-term health effects information. So again, very important. And now we're going to get into what are the acid alkaline foods and drinks. Okay, because you're sitting there, you're watching this or you're listening to this and you're saying, okay, Dr. Patricia, you've convinced me I really should be paying attention to my acid-base balance in my diet, preferably eating more of an alkaline diet so that I'm not stealing minerals from my bones in the short term and in the long term, not only causing issues with osteopenia, osteoporosis, but also potentially inflammation that is leading to many other chronic diseases that we're experiencing in our society, right? Inflammation is a major root cause for all chronic diseases. So let's get into this. And again, this is based on research. They've actually done research where they take each food and they examine the net effect on the kidneys in terms of calcium excretion, and also what is the effect of the acid-base balance in the body. And what's interesting is that some foods may be acidic, right, quote unquote acidic, such as lemon, but they have a base effect, an alkaline effect in the body. So this is not whether or not the food itself is acidic, but whether it has an acidic or alkaline effect in the body. So let's get into it. So acid foods are meat, all meats, all seafood, all dairy, eggs, all whole grains, including things made from whole grains like pasta and bread, most nuts except for hazelnut, lentils, and peas. So now lentils and peas are on the lower end of being acid forming. But I did want to include that there because that was found in the research to be slightly acid forming. Now you may be listening to this or watching this and saying, well, does this mean that I have to be vegetarian or vegan? And you're going to see my opinion on this may surprise you. So we're going to be talking about this. Now, the acid drinks are all carbonated beverages, all bubbly beverages. And this is a big one because what I'm seeing happen is that there's a lot of men and women out there who are buying these bubbly carbonated beverages, thinking that they're making a healthy choice for themselves in terms of whatever it is that they're choosing in the grocery store or making in their home with those stream sodas and such. And unfortunately, they are extremely acidic because of the carbonation in the water. And so we are unknowingly introducing an extremely acid drink into our system that our body is having to buffer through mechanisms like pulling calcium and other healthy minerals from the bone. And over time, that can lead to osteoporosis and the long-term consequences of that. So I want you to understand that I do not drink bubbly beverages unless it is the occasional drink as a treat. And I treat it kind of like candy, right? I know it's not good for me, but I'll occasionally have it as a treat, but I certainly will not have it every day. And I will not let it replace plain water as my main beverage of choice. So the other drink that is acidic is milk because it's in the dairy family. And some beers like pale ale, pale beers are, whereas other beers, which we're going to cover, are not. They're more base forming. So I just find it kind of fascinating how it really matters how the thing is made and what it's made from. And thank you again, Shay, for your lovely comments. I really appreciate reading them. Now I want to dial into the drink. So for example, remember that the pH of our blood is between 7.35 and 7.45. Well, carbonated bubbly drinks are an acid drink of pH of 3 to 4. Now remember, this is logarithmic. So this is a massive difference between the pH of that in our blood, and in the body, it also has an acid effect. Kombucha, which I love, and it can be very helpful, also has a pH of 3 to 3.5 because it's bubbly, it's carbonated. So I don't drink kombucha a lot. I don't drink it every day. And when I do drink it, I think of it as medicinal, like a small amount for the probiotic benefits of it, but I do not consider it a beverage of hydration. Again, I don't replace water with kombucha. So it's a treat that I do occasionally and medicinally. Milk has a pH of 6.5 to 6.9. Tap water is a pH of 7.5, so more alkaline. And mineralized water, which essentially is water with minerals in it, like calcium, magnesium, and sodium, has a pH of up to 9. And so when people talk about alkaline water, basically it's water that has been, either processed commercially, or some people do it at home to add more minerals to it. And those minerals are alkaline minerals, and so it makes the water more alkaline. And I've done a video before. And again, if you're watching this, you can go to my YouTube channel. If you're listening to this, go to my YouTube channel and search how to mineralize water in the search bar, and that will pop up how to make your own mineralized water at home, because tap water is, if it's been filtered, has less minerals in it, so is less alkaline. But you don't need to go out and buy expensive alkaline water. You can simply make your own mineralized water at home using Himalayan salt, for example. So hopefully that will be something that will be of service to you. Now, alkaline foods are all fruits, including lemons. So remember that I said that while a lemon or a lime may be more acidic, in the body, it has a base effect at the level of the kidneys. Now, they explain it in the research studies. I can't pretend to understand. It seems a bit complicated, but the general effect is a base effect in the body. And so fruits are very alkalinizing. Vegetables, except for the lentils that we talked about, are all very alkalinizing. Hazelnuts are the one nut that are more alkaline forming or base forming rather than the other nuts. Herbs are extremely alkalinizing, as is vinegar. Remember, again, it's interesting that some foods may be acidic outside of the body, but have an alkaline effect in the body. Now, what I found interesting is that looking at the tables of, base versus acid and the degree of base forming versus acid forming, the most alkaline plants were spinach, parsley, and kale. And I find that extremely interesting because, when I went to countries like Argentina, for example, they have their steaks, but they also have their little dressings and things with chimichurri, for example. I think I'm saying that right, with a lot of herbs in it. And a lot of cultures will use herbs, as sauces or dressings or in salads, or, as part of their cooking. And so herbs are very, very good alkaline foods that will help balance out the acidity of our acid foods, because it's not that we need to eliminate acid foods, it's that we need to know how to balance them with alkaline foods, and we're going to be talking about that. Alkaline drinks are the tap water, the mineral water, tea, coffee, and wine. So that was surprising to me. It might be surprising to you too. That tea, coffee, and wine are alkaline forming in the body. Now, coffee has a pH of 5, but seems to have an overall base effect in the body. But there is a caveat. Women who have the highest versus lowest intake of coffee have had a 14% increased risk of fracture based on studies. So while coffee is one of those more base than acid, we want to be moderate in our consumption. And wine, although it's alkaline in the body, it has other potential health effects. So again, we don't want to miss the forest for the trees, right? Just because a food is alkaline doesn't mean you can go to town on it. You have to look at all the other effects that it can have in the body and what it is that we can do about that. Like how can we have enough of it? Like the kombucha, for example, it can have really great beneficial effects with probiotics, but I don't want to overdo it, right? And because it is acid forming in the body. Same thing with wine, it's alkalinizing, but it has other negative health effects like liver damage and increased risk of cancer and those sorts of things. So I want you to just keep that in mind as we're talking about these acid alkaline foods. And a pH neutral food is olive oil. I couldn't find it on other oils, the effect on the body on other oils, but I did find it on olive oil. So that's really interesting to know. Now, I'm going to be answering the question, should we all become vegetarian or vegan? All right. So this is very, very interesting. And I have a few questions here. And what I'm going to do is I'm going to limit my answer to the questions on the topic that we're covering today. Okay. So thank you again for being here and for putting in your comments and questions. All right. So my answer to that question is, should we become vegetarian and vegans? And the answer is not necessarily, because of the question of protein for bone health. And what the studies also show, so the other leaves of the forest that we have to look at, is that the animal protein has a stronger effect on growing bone mineral density, stronger bones, than plant protein, right? Vegetable protein, protein from plants. So we need to take that in conjunction with the information that I just provided, which is animal protein usually comes from food that is acid forming. And acid forming foods increase our risk of losing bone minerals, so could increase osteoporosis. But if we don't eat enough animal protein, that could also cause osteoporosis. So how do we balance it out? Now, first, we need to think about how much protein do we need? And this is a study called the Prospective Study of Dietary Protein Intake and Risk of Hip Fracture in Postmenopausal Women. So, sometimes in some areas of research, we can only find research on primarily men. I love that I was able to find research on women in this topic. So, in terms of how much dietary protein intake we should have. And specifically, the risk of hip fractures. This is a very unique study published in the American Journal of Clinical Nutrition 1999. So, how much protein? Basically, when we take all of this information together, the greatest bone loss occurs in elderly men and elderly women who have an average protein intake of 16 to 50 grams of protein per day. So we know that it is not enough protein if we're hitting about 16 to 50 grams of protein per day. But we also need to understand that it matters what the person's weight is, right? A small woman will probably have a different need than a large man, right? Or vice versa. So the research also shows that the increased risk of hip fractures in postmenopausal women occurs when their protein intake is less than 1.24 grams of protein per kilogram of body weight per day. Now, this is a surprising finding, and even the researchers mentioned this is a surprising finding because the recommended daily allowance or daily intake by our institutions is currently set at zero point 0.8 grams of protein per kilogram of body weight per day, which, according to the study, would put us at a significant increased risk of osteoporosis leading to hip fractures. So, not just bone loss, but the negative effects of osteoporosis, which is the hip fractures. When you have a hip fracture, your risk of dying increases to 70% if you're not treated surgically, and 20% if you are. And so we want to really avoid the hip fractures because we do not want to have an increased risk of dying or needing surgery, right? So let's work through what that would look like for, let's say, a 54 kilogram woman. That means that if we were to take 1.3 grams of protein per kilogram of body weight per day, that she would have to have a minimum of about 70 grams of protein per day. And, you're hearing a lot about, we should be having between 20 and 30 grams of protein per day. That's big on social media these days. And if I'm eating 3 meals a day at 25 grams of protein per meal, that's about 75 grams of protein per day. If I do 20 grams of protein per meal, that's 60 grams of protein today. So protein per day. So that's not enough, right? I want to hit that minimum of 70 grams. So I want to get more towards the 25 grams of protein per meal. And this recommendation is actually quite similar to the European Society for Clinical and Economic Aspects of Osteoporosis and Osteoarthritis consensus statement. And they say similar between 20 to 25 grams of protein per kilogram of body weight. It seems like additional research has shown that the higher end range of that is better. And there's an expert, Dr. Gabriel Lions, who's recommending 1.2 to 1.6 grams of protein per kilogram body weight. And it's not from the perspective of bone health, but from the perspective of muscle health. So, how much protein do you need to have healthy muscle, which is also obviously very, very important. So let's say I use that higher range. We know now what 1.2, 1.3 would look like. What if I was doing 1.6 grams of protein per kilogram of body weight and I'm a 54 kilogram woman? That means I would have to eat about 86, 87 grams of protein per day, which is roughly 30 grams of protein per meal. So it seems like a range of 25 to 30 grams of protein per meal, or between 70 to 86, 87 grams of protein per day is ideal when it comes to bone health and muscle health. The caveat here is that some people are advocating for very high protein. Like some people are saying you should even go above 1.6 grams per kilogram per day. Now, what the research shows that when we look at it from the bone health perspective, very high protein intake actually increases our calcium excretion and bone loss. So there's a Goldilocks range for protein where there's a Goldilocks range of protein where too little protein will result in bone loss and increase our risk of osteoporosis. And too much protein will also result in the risk of bone loss and increase the risk of osteoporosis. So it's that zone in the middle between 1.2 to 1.6 grams of protein per kilogram of body weight a day where we seem to find the most benefits with respect to our health. And that research of the high protein causing problems and with bone loss was actually again done in a group of young women who are consuming different levels of dietary protein, low versus medium versus high. And they ended up having more bone loss with the higher end range, and with the lower protein in the short term it wasn't enough to see the bone loss, but they did see what's called hyperparathyroidism. So we don't want to develop that, right? That also affects bone loss and what's called calcium balance. So we don't want to have that happen either. So again, staying in that Goldilocks range with the ideal protein target of 1.2 to 1.6 grams of protein per kilogram body weight per day. So then the question becomes how much vegetables and fruits to balance out the acids in foods. So we're going to talk about what that is. I do have a few questions here from the audience. So could you please give an example of how much protein is in an egg? It really depends on the size of the egg. It could be anywhere between 6 to 9 grams of protein, more towards the 6 grams of protein probably. So that means that you're probably not trying to get your protein just from eggs, for example, because sometimes you're going to be eating 2 to 4 eggs in a meal. It's really about mixing your protein sources, which is what we're going to be talking about. The other question Shay's having is what is the best supplements for osteoporosis itself that I recommend? This is actually going to be the topic for my next Wild Wisdom show. So stay tuned for the next show if you want to learn all about osteoporosis prevention and reversal supplements. So that's a great question that I will be addressing shortly. So back to how much vegetables and fruits should we be eating to balance out the acid foods? Because what I hope you've gone up, from what I've talked about up until this point is that we need to have a predominantly alkaline diet, right? At least neutral, if not alkaline, to protect our bone health. We need to avoid having too much acid foods in our diet without the balancing out of the alkaline foods. But it's not that we want to eliminate the acid foods, because those acid foods have nutrients, and I focused on protein, but they have other nutrients too, like B12 and vitamin D, which are very hard to get from the plant world. And so the animal protein has this very bone strengthening effect. It also has a muscle building effect. Research looking at does plant protein or animal protein build more muscle mass in women, and basically animal protein does. So then how do we put those two pieces of information together? How do I eat an alkaline diet but still eat animal protein or enough protein, right? So the answer is that there actually was a study done, again, on women, which is so cool, showing that 8 to 10 servings of fruits and vegetables a day is enough to decrease inflammation. So we know that the effects of an acid diet is that it will induce inflammation. And so if we want to combat that, we need to neutralize the acid with the alkaline. And there is no specific study really you eat this much acid and how much alkaline food do you need, and kind of looking at the bone and how that happens. But there's some other studies that indirectly show us that when we eat 8 to 10 servings a day of fruits and vegetables, our inflammation goes down. So it's combating that acid effect. And so what that looks like is probably 2 to 3 servings of fruits a day, because we don't want to overdo fruits. Again, we want to be mindful that we want natural sugars from our fruits. Our body can handle them and they can process them without causing significant problems with our blood sugar control and those things. But if we overdo them, then we start to overwhelm our body's ability to process the natural fruit sugar. So keeping to 2 to 3 servings of fruits a day is probably adequate, which means that you're going to be having about 6 to 8 servings 6 to 9 servings of vegetables a day. Now that may sound like a lot, but I can tell you that's what I eat. And what you do is, in order to hit those targets, is that you're going to be eating about 80% cooked vegetables and about 20% raw. And the raw vegetables are the ones that are fairly easy to digest, like the leafy greens, like the lettuces, the arugulas, the radicchios, and all of those, like soft greens. And then the ones that are more tough and more difficult to digest, like your kales and your broccolis and your cabbage, maybe even your carrots and all the other, more hardy vegetables, you want to cook those, because otherwise it's very hard on the digestive system. It can start to cause a lot of digestive distress over time. And our body has evolved from being very, from our ancestor, the apes, that have very large chests, like wide chests, with to accommodate a really long gut in order for them to be able to digest all of those raw foods. Because we invented the art of cooking, since we mastered fire, our digestive system, and you can tell from the skeletal data, our skeleton has really decreased around the rib cage as our digestive tract has gotten shorter, because we are relying on cooking to help process and pre-digest those foods. So I have worked with a lot of people now, and I notice that people who eat a lot of raw foods over time start to run into problems with digestive distress. And so just be aware that as we age, our digestive capacity decreases. So when we're younger, we're able to eat more raw, crunchy foods, fruits and vegetables. But as we, so younger, it's easier, older, it gets harder. And that's just a known fact. Our digestive enzymes change, our digestive power decreases. So this is a tip for you how to hit this target, because also the cooking decreases the volume, right? So a big, 2 cups of kale, when you cook it, like withers down and becomes quite small. And what I can tell you is that quite a bit of the nutrients are still left there. All of the fiber, lots of the phytonutrients, all of the minerals. So yes, you may lose a few raw enzymes, but it's not enough to counteract the effects of, the benefits of eating the food primarily cooked, some raw. So again, you can have a salad, but you're probably going to want to have a variety of cooked vegetables in order to meet this 8 to 10 servings a day of the fruits and vegetables. And this is what I do in my daily life. So it is possible, but it takes time. And don't go from 0 to hero. Like, don't go from not eating a lot of vegetables to all of a sudden eating a bunch. You will run into problems because your body just won't be used to it. So it needs to build up the tolerance. So just slowly increase over time. Now, what we're going to talk about is the dairy and calcium conundrum, because the studies show that protein is more effective for bone health when there's enough calcium intake and the vitamin D levels in the blood are adequate. And these were actually the studies that were done looking at whether animal protein and plant protein, which ones were better, and showed that animal proteins were better. But in both groups, whether you were eating primarily animal protein or primarily plant protein, how much calcium you were taking in and how much vitamin D level you had in the blood would influence how well that protein could be used to support your bone mineral density. In other words, your bone mass, right? Your bone health. So what the research shows is that when the calcium intake is below 800 milligrams a day, the risk of hip fracture from osteoporosis increases significantly. Now, the minimum recommended daily allowance is 1,200 milligrams a day for women. So, we're saying like minimum is 800 milligrams, but ideally you should target 1,200 milligrams a day. Now, calcium absorption from dairy is 27%, which means that if you take 100 grams of calcium from dairy, which you never would, but just giving an example, you would only absorb 27 grams of that calcium, right? So it's not like everything in the dairy comes into the body from the milk. But as we said before, dairy increases acid load. So do we want to get all of our calcium from dairy? The answer is probably not. We're going to have to get it from other sources so that we don't overwhelm our body with too much acid load. So the interesting thing is that the calcium absorption from various vegetables is also 27%. So mustard greens, turnip greens, bok choy, cabbage, broccoli, kale, spinach. If you eat 2 to 3 servings of those vegetables then you get the equivalent of calcium that you would get in one serving of milk. So the downside of the vegetables being the source of calcium is that you have to eat more servings. But if you're targeting that 8 to 10, fruits and vegetables a day, you're probably going to be hitting those numbers. And the interesting thing is that the exception was Chinese mustard greens had such high calcium content and bioavailability and absorption that it was equal to one serving of a cup of milk. So, I just thought that was really cool and I had to include that. Now, the other thing you need to know is that table salt, so sodium chloride, which is not the same as Himalayan salt, which is sodium chloride plus other minerals like magnesium and calcium and so on. The table salt has been shown to increase calcium excretion. So you lose calcium the more table salt you have. And interestingly, the highest concentration of table salt that we are exposed to in our diet is from ultra processed foods because it's hiding out in very high amounts and in the bread. So not the bread that your baker makes, for example, that's very fresh on the shelf and will go moldy in a short period of time, but those commercial breads and bread rolls that sit on the shelf in their plastic bags for, weeks on end, those commercially produced breads, mass-produced breads have a ton of table salt, and people get worried about how much salt am I adding to my vegetables and am I adding to my meat or to whatever. That should not be our concern. Our concern should be how much table salt am I unknowingly eating through these ultra processed foods and commercially produced breads that are actually driving my health problems, such as my osteoporosis and my hypertension. So because too little salt is equally, if not more damaging than too more salt. Again, salt has a Goldilocks zone. And if we get rid of our ultra processed foods and commercially processed breads and go towards our fresh breads, go to the bakery or make your own, whatever it is that you want to do, and minimize ultra processed foods, you're probably going to find yourself naturally in the Goldilocks zone, and salting your food that you're eating, your whole fresh foods and vegetables to taste, it's probably going to land you in that Goldilocks zone of not too little and not too much. So the take-home message here is that for an anti-osteoporosis diet, you want to eat an alkaline diet, which basically means you're eating 8 to 10 servings of vegetables and fruits a day in order to balance out your acid foods, such as your meats and your dairy and your eggs and your grains, all of which are important for health. But if eaten in high quantities compared to vegetables and fruits, so if you overeat the acid foods and undereat the alkaline foods, the body's going to compensate by pulling minerals from the bone. And over time, this can lead to osteoporosis, inflammation, high cortisol, and all of the conditions that come with that. So we want to really look at the ratio, the balance. You want to have a balanced acid-based diet. You also want to target 1.2 to 1.6 grams of protein per kilogram of body weight a day. Ideally, if you can, more from animals rather than plant sources. But if you're vegetarian and vegan, you're going to be watching those numbers. You're going to be going towards the higher numbers, more of the 1.6 from the plant foods. And you have to ensure that you're hitting at least 800 to 1200 milligrams of calcium per day. In this case, more from plants than animals, right? So from your vegetables, for example, and really avoiding those acid forming drinks and those also ultra processed foods, because those are the sneaky ones. And those are the ones that we can accidentally consume in large quantities, such as the bubbly drinks, such as the ultra processed foods that are labeled as healthy, organic, or natural, or baked. Oftentimes, even with these, greenwashed or health wash labels, they are hiding a lot of unwanted nutrients, including table salt, sodium chloride in very high amounts. And that can lead to potentially over time problems with bone health and osteoporosis. So my next episode, we're going to be talking about supplements and beyond calcium to support bone health. I also want to mention that if you're catching this as a replay or if you're watching this now, I have a playlist on YouTube called Bone Health, so the Bone Health playlist. And this is where I'm going to be dropping all of my videos on this topic. So, I've already done one on the root causes of osteoporosis. This is one of the root causes, and I talked about 12. I talked about already exercise, the very specific kind of exercise proven to reverse osteoporosis in postmenopausal women. So it'll definitely prevent it. And in the future, we're going to be going to supplements, hormone replacement therapy for those who are interested, and so on. So please stay tuned. Now, what I want to do is I do have another question, a couple of other questions. So one question from Cheryl is, if I drink 3.2 liters of water every day, will it help to lower sodium in my body? So, Cheryl, when I dig into the research on hydration, first of all, we can overdo hydration, but the optimal target of hydration for a woman is around 2.5 to 3.5 liters a day. But that water needs to be mineralized. So, actually, we need to have enough minerals, and sodium is just one of the minerals. There's also magnesium and the calcium and potassium and all these other minerals that the body needs in order to pull the water into the body and make sure that the body has enough of a balance between water and minerals. If we drink water, if we're drinking 3.2 liters of water a day that is not mineralized, so for example, regular tap water, it could actually be dehydrating because the water just gets excreted, just gets dumped out of the body because it doesn't have enough minerals to pull it in. So the answer is I'm not exactly sure, but whatever water is that you're drinking, you want to make sure it's mineralized. Again, go to my YouTube channel, check out how to mineralize water with Himalayan salt. Put it into the search bar and you'll find it there, and watch that video. It's about 15 minutes. It'll teach you how to mineralize your water at home. And that will help appropriate hydration, and appropriate hydration should maintain a good mineral balance in your body. The other question is from Shay, is osteoporosis hereditary? So I like to think of it as, the genetics can load the gun, but the environment pulls the trigger. So yes, some people can have a genetic predisposition to osteoporosis, but research shows that very, very few of people who have conditions like osteoporosis actually have it 100% from genetics. Now, there are genetic conditions that predispose to bone disease and can cause those problems. And so there's that can cause brittle bones, osteogenica imperfecta, like all these things. But the kind of osteoporosis I'm talking about today, which is based on maybe some women may be more vulnerable to developing it, but it would require the additional layering on of, lifestyle, diet, stress, lack of the appropriate exercise, those sorts of things. Because research has also shown that even if you have the genetic predisposition, you can reverse osteoporosis with the appropriate holistic strategies, which I'm discussing in all of these videos. So while it can be genetically predisposed, it is not your destiny. And it doesn't mean that you can't reverse out of it if you put a really good effort into it. So I hope that answers your question. So thank you, everybody, for joining me today. I hope you have a wonderful rest of your day, evening, or night, depending on when you catch this. If you enjoyed this, please subscribe, save, and share, because sharing is caring, and you never know when someone's going to benefit from having this wild wisdom in their lives. So I look forward to seeing you soon. Bye now.